Thank you, Nina. Hello. Awesome. I'm just going to share my screen. We'll go through a quick presentation. Well, hello, everyone. Thanks for being here. Welcome to our live session. I'm going to be going over a quick startup presentation to welcome you all and introduce you to our program and various opportunities if you have not previously attended our shadowing sessions. As you guys know, Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. My name is Carter Chasen. I'm a volunteer at Pre-Health Shadowing. Thank you all for attending today. Let's get started. Just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen. If you need assistance enabling the transcript, please direct message one of our team members. We're always looking for ways to be more inclusive and ensure our sessions are accessible to everyone. So please, if you have any recommendations for how we can improve, you can email us at info@prehealthshadowing.com. If you want to stay in the loop, feel free to follow us on social media. We're active on Instagram and TikTok, or sign up for our email list on our website to never miss a session. So since this is an international program, we want to know where you're zooming from today. Drop in the chat. I'm calling from California. We also have some wonderful opportunities for all as benefits being part of our program. Additionally, we partnered with Krispy Kreme for you to purchase 1 dozen donuts to enjoy with your loved ones. With a donation of $10, you'll be able to receive your treat while also helping us at PHS. More information and instructions can be found by clicking the link set in the chat, and we'll send that momentarily. Also, if you want to play a bigger part in supporting PHS, we'd love for you to join our network of student volunteers, team members. You can also apply to be a part of our administrative team, which will help lead students in various projects, initiatives with healthcare professional outreach, grant writing, and more. We understand that as a Pre-Health student, you may not have the time, so we also offer the opportunity to volunteer asynchronously with our tasks that can be done on your own time. We would love to have you be a part of this program and contribute to your own unique perspective. Along the lines of that, PHS is taking great pleasure to announce the newly available Pre-Health Shadowing leadership positions for the 2021 to 2022 academic year. Our organization welcomes students of all majors, education levels, demographics, and professional interests who are eager to make a difference in the field of healthcare. Students can take on leadership roles remotely and apply to any of the following positions on the screen. As a student-led organization, members of our team take on various roles that encompass project management, volunteer coordination, and collaboration amongst fellow peers. Additionally, each of these chief positions will be accompanied by possible assistant chiefs. Lastly, keep in mind that students are given the flexibility to create their own schedules. However, members are expected to commit a minimum of 5 to 8 hours on a weekly basis. So if you want to gain experience in leadership and further your skills, please click on the link sent in the chat. If you have any questions, feel free to message one of our board members and we'll be able to assist you. Additionally, if you're a high school student and want to get involved, we've started a program called High School Training for PHS, which allows you to connect with college pre-health shadow programs, get involved in fundraising for pre-health shadowing, organize resources for other high school students interested in medicine through the PHS resources. We also want to recognize the hard work of all of our students in the program. So if you're interested in getting published, you can submit essays, reflections, research papers, reviews to our editor and chief through the link dropped in the chat as well to have your own work on our website. This will look great on cover letters, applications, resumes, so take advantage of this. Also, we ask that if you can, to humbly donate to our program. As you know, Pre-Health Shadowing is completely student run. We're working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution that you could give would be greatly appreciated. If you're not financially able, we request you send this link to someone you think that can continue to support us, those who can't afford the similar opportunities. Also, throughout the session today, we encourage you to drop any questions you have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session. And also take good notes as our professional is going over the presentation, as there's gonna be a chance to take a pre-shadowing assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned. Lastly, if you can, we request you turn your cameras on. This by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. We also request that you make sure to mute yourself, as this will ensure the professional has time to complete and full attention from the audience. Well, I appreciate you for listening. Now I'd like to welcome Dr. John Crowe. Thank you so much for joining us today. You may share your screen whenever you're ready.
Thank you. Okay, does that look like it's working for us?
Yep, looks good.
Okay, thanks very much. And I appreciate everybody joining me today. I want to make sure that everybody has the chance to ask whatever questions they have. So throughout my presentation, please feel free to drop questions in the chat. I'll be looking at that. And you're welcome. If anything I say doesn't make sense or you want clarification, just let me know. The basis of my presentation is things that nobody ever told me, but I wish they had. Unlike some, I didn't grow up with parents in the medical field. I kind of had to figure everything out on my own, and it was really hard. And I always thought that a way for myself to give back after I got to where I was I would spend a lot of time doing teaching and mentoring and trying to give people the best advice that I could, which is basically what this presentation is all about. So essentially, through all the mentors that I've had through undergrad, through medical school, all the way up through being an attending, I've had a lot of them, but a lot of the information that people give you is either wrong or it's really sanitized. They don't tell you the real stuff, or it's not really useful information, or it's outdated. So hopefully this is more of the real story. So I'll start out with what's probably of interest to a lot of you, which is what nobody ever told me about getting into medical school. The acceptance rate for medical school is really low, 7% per year of all the people who apply. And that's of the people who think that they have a shot. There's a lot of stuff that matters. There's grades that matters, your MCAT, if you have research, whatever opportunities you have for shadowing and volunteering, like this kind of thing, it all matters. But in general, it's really tough. No matter what you do, you might not get in the first time. I personally didn't get in the first time that I applied for medical school, and it took a while for me to figure out why and figure out what I needed to do about it. I got in the second time. When I was an undergrad, I had a nice cushy job. I worked at the public library. I was a reference librarian. It doesn't sound like much now, but I was making $13 an hour. But the problem is that part-time job that I was doing about 20 hours a week, I thought it would look nice on my resume, but it wasn't really medically related, and it was comfortable and it got me a decent income, but it didn't get me into medical school. So after I failed to get in, I quit that job. I decided to throw myself into my application as much as I possibly could. I did hundreds of shadowing hours. I took a difficult job as a phlebotomist. Not difficult because phlebotomy is difficult, but because I had to wake up at 3:30 for a 4 a.m. to 7 a.m. shift. And I decided to take the MCAT again to see if I could improve my score. The secret to the MCAT, by the way, and all multiple choice tests that you're going to take into the future is practice questions. If you do more practice questions than the next guy, it's probably going to be the thing that gets your score up. You can read all the books you want, you can look at all the videos you want, but simulation of the actual experience is the best way to get through it. And when you're going through your practice questions for the MCAT, the things that you want to do is do the question, see if you got it right. And if you got it right, but for the wrong reason, or if you got it wrong, treat it the same way, take some notes about it, enough to at least get you the question next time, and move on to the next question. Do as much of that as you can. That's my recommendation. One of the other reasons why I didn't get into medical school the first time was that there were a bunch of other kids who frankly didn't have part-time jobs. They weren't working. And so they sort of collected volunteering and shadowing hours throughout their college experience, kind of like catching Pokemon. There was a cabal of people that all stuck together and all did all their volunteering together, but I just never had time because I was working at my job. It turns out it gave them an advantage, and a lot of them got in where I didn't. And the reason why was they did more shadowing, they did more volunteering, their resumes looked better than mine. And so that's what got them in. You know, if you have somebody who is in the medical field that's your friend or your family member, it's not a bad thing to work those angles. Everybody, you know, the 7% that are getting in per year, they're working every angle that they have. So don't just say to yourself, well, just because my dad's a physician, I don't want to use that because that doesn't seem fair. Forget that, because honestly, everybody else is using it, and it may mean that your high-mindedness means that somebody else gets to be a doctor, but you don't. So I strongly recommend use every angle that you have, do as much as you can. When I didn't get into medical school for the first time, it was really, things had gone well for me in high school and undergrad. I was class president. I was in charge of a bunch of different clubs. Homework in high school and college all came pretty easily to me. And so I figured that medical school would just be the next thing that I would apply for and get in. And so when I didn't, it was a real reality check moment for me. It was hard psychologically, and I had to figure out who I was. Was I the guy who was going to give up, or was I the guy that was going to throw absolutely everything that I had at it to make it work? And it turns out that I was the second guy. I basically wrote down a list of all the things that I could do that I thought might improve my application, and I did every single one of them. Some other advice, if you're applying for medical school, because I've been on the other side of it. When I was in medical school, I actually was on the admissions committee for a year, and I interviewed several people. The thing to do is to try to make yourself more interesting. You know, don't just stick to all the biology and chemistry stuff. Maybe get a minor in something that you're passionate about, whether it's oboe or Spanish or interpretive dance or art history, something that makes you interesting, something that you like talking about. I think that that's something that can actually really help distinguish you from all the people who just did biology and chemistry and don't know anything else. They're looking for more well-rounded people these days. Finally, if you're looking at your application and you're satisfied and you think it's enough to get you in, then maybe you're wrong. The 7% per year, this is literally the biggest hurdle that you have to do to become a doctor. Everything after you get into medical school, you know, 95% of the people who get into medical school make it and become doctors, which is great. It means you have much better chances, and people are there to try to help you through that process if you're starting to stumble. The thing that's really hard is just getting in. So throw everything that you possibly can at it if you're serious about it. Okay, trying to advance my slide here. So this is a picture of me when I was a third-year medical student. It's a picture of a guy who really had no idea what he was doing. This is back in December of 2012. So back when you guys were in third grade or something like that. It turns out that medical school is hard. It's really hard. Your classmates might pretend once you get there that they're not having a rough time, but it's challenging for everybody. Despite everybody that's around you that's going to be putting up this thin veneer of competency, you really got to know that everyone in medical school is fighting their own battles, and you're probably doing fine. If you're not on stimulants or antidepressants, you're probably in the minority. I found out sort of later down the line that there were a bunch of people that had, through their contacts, gotten scripts for things to help them focus, all sorts of stuff, which I strongly recommend against, by the way. I never did anything like that, and it just hurts you further down the line. But you're going to be up against a bunch of people who are doing everything they can to get ahead. The first classes I had in medical school were biochemistry and cell biology. And I remember the first test really well because I had decided I was going to throw everything I could at it. I studied harder for this first test than I had for anything in my whole life. It was the most that I'd ever studied. And I felt like, you know, if I'm doing my best, I'm working my hardest, then I'll do fine. And, you know, I thought it would be fine. My first test, I got a 78% on a C+. And I had classmates and colleagues that had 98, 99% after working as hard as I could. This was another reality check for me. It's like, wow, I had no idea the caliber of people that I was here with that had already figured out everything about needing to study and everything else. It turns out that things got better. I figured out some things about how to study, and I'm going to share some of those with you as well. But just keep in mind, if you get into medical school and you feel out of your depth, maybe you are, but I bet if you double down, you can make it work. It's not impossible. I ended up doing fine. Here's what people never told me about M1 and M2 year. Lectures are terrible. And I know this is a little bit ironic because I'm giving you a lecture right now, but truthfully, they are. It seems kind of obvious, but it's worth saying. Have you ever spent a bunch of time studying slides only to find out the slides have almost nothing to do with what's on the exam? Yeah, that's essentially medical school. I didn't understand this for a really long time, but what you have to think about is how some of these lectures actually come into existence. So there's somebody who's in charge of the curriculum, right? And I appreciate the fresh air thing in the chat. I'm trying to tell the real truth about this stuff. So there's somebody who runs the curriculum that has to figure out the topics for the year. This is probably based loosely on last year, and it has something to do with what's covered on board exams. So when they find a topic, they find a subject matter expert. Okay, so this is probably some PhD who has some research that might be tangentially related to this field. These are the people who have enough time to put together lectures for you. They're usually not physicians, they're PhDs. And this is where the disconnect happens. Next, they write a PowerPoint about whatever it is that they want to share with you. Mostly they like talking about things that are more relevant to themselves. So it's whatever made them an expert in the field. So if you see a bunch of random slides about their research or about stuff that's the opposite of clinically applicable, there might be some nuggets of truth in there, but they're buried under a mountain of BS. And that is really what figuring out med school is about, is figuring out what you actually need to study. Now, here's the important part. Somebody has to write questions that have to do with these PowerPoints, but where do these questions come from? It turns out it's not usually from the professors. They come from some question bank that the school has created that is based on high yield board review topics. So you have to ask yourself the question, should I spend more time listening to lectures? Or should I study the high yield board material in the first place? Do any of the people that are teaching me have any credentials as an educator, as a PhD, or are they just here because they have some credibility as experts in their field and don't really have any interest in teaching? Maybe they get a stipend for this. My M1 year, I went to every single lecture. I took notes. I got home. I studied everything again, went to bed late, rinse and repeat, and I did okay. I ended up somewhere in the middle of my class. I had a B average for whatever that's worth. My M2 year, I switched my strategy completely around. I only went to the mandatory lectures. In the mornings, I would go to the gym, I would sleep a little bit more, and lectures that didn't seem helpful, I just discarded, and I focused only on the high yield resources. Between M1 and M2 year, the grades on average for our class dropped by about a letter grade. So if the average was a B as an M1 for everybody, it was a C for M2. But my letter grades actually went up a letter grade on average because I adopted this new strategy. Because I was ignoring all the stuff that didn't matter. I was focusing on what the tests were actually about. this is why somebody else got a 98% on the first test, is they already knew this and I didn't. So figure out what the hidden curriculum is, find the review books that have high quality multiple choice questions. That's what your professors are doing. That's what they're basing their questions off of. That's how you succeed. And then lastly, in M1 and M2 year, I was burning myself out. My M1 year, I was spending all this time. I wasn't getting much sleep. I wasn't getting to the gym. This hurt me. It meant that I thought that if I just studied the PowerPoints more, then I'd figure it out, but it's not actually the important part. You got to take some time for yourself. It's a reasonable amount of material if you're just studying the right things. Make friends, see what they're studying, ask the people who are doing well what they're studying. That's the way that you get to be successful in M1 and M2 year. I wish somebody had told me that. Advice for step 1 and step 2. Recently, step 1, which is the first part of your board exams, moved to pass-fail in January of 2022. This is not good for you, unfortunately. My advice for those of you that are taking it pass-fail, I want you to treat it like it's still a scored exam. There were a bunch of questions that were on the step 2, which still has a score associated with it, that I only knew because I randomly remembered it from studying for step 1. And from what I hear, step 2 is going to be the new step 1 in terms of ranking applicants for residency, because you got to have some testable measure of how someone is that's applicable to all medical schools. And if you don't have that, then it's just based solely on where you come from, which really is unfair. So treat step 1 like it's scored, do as well as you possibly can. And then for step 2, that's going to be the big test that matters now. Do as well as you possibly can on it and use that as the thing that helps supplement your application. Also, I learned a lot between taking step 1 and taking step 2 because I got a score in my step 1. For step 1, I used as many resources as I could. I used a video review course called Doctors in Training. I did UWorld questions, did a bunch of review books, and I even stupidly decided to go back over some of my M1 and M2 lecture slides because those were so helpful. I studied for 2 months, but by the end, I had definitely forgotten some of the material that I'd learned over the first 2 weeks. If all you're doing is studying all day for 2 months, you start spinning your wheels. I studied very hard. I took it very seriously, and my score was exactly in the 50th percentile, which not terrible, not great, average, which is once you get into medical school, just fine. For step 2, I completely changed my studying strategy. I zeroed in on what I thought helped me the most, which for me was UWorld questions, which is a question bank that you'll become familiar with. UWorld, First Aid, Pathoma, Sketchy Micro, those are the resources that all of the smart medical students are using. That's what people are using to help memorize stuff. I recommend all those things. So when I did those questions, if I got one wrong or I got it right for the wrong reasons, I just took notes in a little notebook about it. I only occasionally used other resources to look something up. And at the end of the day, end of the week, I would browse through those notes. I did that for 6 weeks instead of 2 months because 2 months was too long. I was spinning my wheels. And my score on step 2 was in the 80th percentile. So pretty dramatic improvement from 50th percentile to 80th percentile. I studied just as hard, but I studied the smart way and I did a lot better. This is me as a 4th year medical student. So these are some of the things that I learned about being an M3 and M4. Now that we're kind of coming out of our COVID isolation shells, this is really the period of time in which you get rocked with the most socially intense portion of your life when you're in M3 and beginning of M4. And how you perform in 3 and 4 is what determines if you can afford private school for your future offspring, unfortunately. So that's why I have some advice for you here. So imagine that you're a freshman in high school and you don't know much about anything. It's a new school, but you're given this assignment. Go sit at the lunch table with the juniors and seniors of some popular cliques. You have 1 month to make them really like you, and then you switch lunch tables. You have to sit with the band geeks, you have to sit with the football players, you have to sit with the cheerleaders, you sit with the guys who are super into their cars and the goths, and then there's a weird group of outcasts. And at the end of the month, they all submit written reviews of you that determine where you go to college. And you also have to get straight A's while you do this. This is essentially what your 3rd and 4th year are about. It's very challenging. Your clinical grades literally are based on how much people like you. And the thing is that most physicians have really sensitive BS detectors. A lot of people who get into medical school have a lot of pride about their knowledge and are afraid to say that you don't know something because you feel like you should if you're being asked the question. But much better to say, I don't know that yet, than to just make up some BS and try to fake your way through it. Because, now that I'm attending, I see this all the time. It's really tiresome. Just say you don't know so that I can teach you the thing that I'm asking you about. That's what most of it is. If I'm asking you a question, it's because I know the answer and I would like to share that answer with you. It's not so much most of the time that I'm trying to pimp anybody or figure out like, how much does this student know? But I am trying to figure out if I can give you this teaching point or not. And if you're spending 2 minutes BSing me about how you know something else that's related to the topic, then I don't care. Much better to just say, I don't know that yet, and let them teach you. The other thing, you have to really project confidence and positivity, but don't be a gunner. And you might be asking, what's a gunner? A gunner is somebody who doesn't just see their assigned patients, they see yours too. And maybe, the attending asks, well, what's the potassium? And you've forgotten, but the gunner pipes up and he says, well, the potassium was 4.3 today on this patient. It's somebody who throws other people under the bus to make themselves look better. Nobody likes a gunner, especially attendings. It's not a good way to get through school. We had somebody, the biggest gunner in my class ended up not matching on match day to their preferred specialty. And everybody was secretly thrilled because everybody didn't like this person. Don't be that person during med school. Don't burn your bridges. Don't be a gunner. And then the last thing is residents and attendings. Like, I'm still just a guy. It's easy to put attendings in this box like, oh, wow, they're so unique and special and interesting. No, we're just all people. And the judgments that we're making about you are just as people too. We're no different than you guys. We're just older, basically. So if you're hanging out with an attending, if you're on rounds or whatever, imagine the attending thinking to themselves, do I want to be on call with this guy at 3 a.m. or not really? If you think you're being annoying, you probably are. Just back off. Just be a normal human being. That's the way to get ahead. And that's the way to make people like you. So most of the time, M3, M4 year is like a personality test. If you find yourself fitting in with a certain group, I advise you to pay strong attention to that. You'll naturally learn the material better if you like the people that you're working with, and you'll like your job more. Try to stay away from saying to yourself, well, it's hard to tell whether I like the specialty because I just don't mesh with any of those people. Odds are, specialty's not for you. There's always exceptions, of course, but you can pretty much tell in the first few days of your rotation if these are your people. The other thing that I always tell people is figure out what you aren't willing to do. If you're not willing to dig around in a necrotic butt abscess at 3 a.m., you probably don't want to be a general surgeon. If you don't ever want to intubate or resuscitate somebody with meth mouth who's bleeding from multiple gunshot wounds at 3 a.m., you might not want to do anesthesia. And if you don't want to be writing consult notes and endless HPIs at 7 p.m. for your 12th day in a row, maybe not do internal medicine. It's not so much about picking the things that you super like or super into, but avoiding the things that you know that you hate so that you don't burn yourself out. Because the things that you really like will become boring after a while. For me, I thought it would be really cool to be an anesthesiologist for trauma patients, and it still is, but my heart rate doesn't get as high anymore when I'm handling one of those gunshot wounds and doing a resuscitation and crash intubations. It's something that I have the skills for now and that I can do, but it does become a job after a while. The thing that gives me joy in my job isn't those things anymore, but it's more about teaching other people how to do those things. That's what keeps it interesting for me. So make sure that you take that into consideration and figure out what you don't want to do as a specialty. So here are some of the reasons why I picked anesthesiology. The first thing I did, I had a How to Choose Your Specialty book, and I was flipping through it, and I didn't even consider anesthesia as a specialty because I just didn't know much about it. I decided to do some shadowing, and I felt like it was just people that I fit in with pretty well. They just seemed like human beings. They had a sense of humor. They were laid back. The other thing that was really good about anesthesiology, there were minimal notes. There was no rounding. There was no clinic. It was really more about applied physiology and pharmacology. Instead of typing in to give the patient however much beta blocker per day and hoping that the nurses do it, I'm drawing it up myself. I'm giving it to them, and I'm watching their heart rate in real time. I think it's really interesting to have a human physiology lab in front of me and to be able to make sure that my patients are 100% compliant. One of the things I put on here is that I get to wear scrubs every day, so no more professional dress. But look at me, I wear this just for you guys. But in general, I wear scrubs every single day, which is nice. I hate wearing professional dress, and I even have some uncomfortable shoes on. But anesthesia, you get to wear scrubs more often than any other specialty. So that's a bonus. And then lastly, when you're looking at different specialties, they make different amounts of money. My wife, who I met in med school, she's a pediatric cardiology fellow right now. She's just about to finish up. And despite her doing 7 years of training, she's making the job offer that she got, which is normal for her specialty, is significantly less than I make. It has everything to do with procedures. Anesthesia does lots of procedures. They're in the OR all the time, and plenty of procedures translates according to the payment structure that we have in our country, plenty of money. So procedural specialties, you're going to make more money, and that's all there is to it. It's not the primary reason why I picked anesthesia, but it's definitely a reason why I considered it strongly. Now, there are also some really good reasons to not pick anesthesia. It's really not a specialty for people that have a very high ego requirement. Some people get into medical school because their dad and their grandfather were surgeons, and they have very strong feelings about having people call them doctor and looking up to them, all that kind of stuff. If that's you, and there's actually nothing wrong with that. I think there are a lot of good physicians who that might be their primary motivation, is to feel important. Nothing wrong with that, but maybe don't do anesthesia if that's you. If you want all the patients to know that you're a doctor and for everybody to think that you walk on water, then anesthesia is not that. If you're somebody that, if you hear a code alarm go off and you start walking the other way and you're like, oh, I don't want to go to that, also probably not for you. If you're the kind of person that agonizes over tiny decisions and you really want to make everything perfect in every way, then again, that's not really anesthesia's thing. We make quick decisions, and sometimes we're wrong, but then we fix it when we're wrong. if you are really satisfied after you write a really long, detailed note about a patient who's difficult to get history from, that's not anesthesia at all. I have a very focused history and physical exam that I do that takes about 3 minutes. And I think it covers almost everything that I need to keep patients safe and comfortable. And lastly, if you think medicine is very serious and there's no laughing or joking, then again, anesthesia is not for you. We're a pretty laid back group of people. We like joking around with each other. We have a good time. Now, next I'm going to talk a little bit about how I matched into anesthesia. So that's what you do your M3, M4 year to try to make sure that you have a job when residency starts. Anesthesia rotations, for a lot of people, aren't taken too seriously. It's because the residents that you're hanging out with or the attendings you hang out with, they're usually pretty laid back. They let you go by noon. It's a nice, easy day. They might let you intubate. They might teach you for a little bit and they say, hey, get out of here, go home. If you're somebody who wants to do anesthesia, then I suggest just taking the rotation seriously. Here's what I did. I essentially decided I want to do this anesthesia thing. It's really important to me. And so I'm going to do everything I can to make it happen. And so just like I did when I didn't get into medical school the first time, I made myself a checklist and then I just did everything on the checklist. I asked myself, what can I do to maximize my odds of matching? I found kind of a niche publication. It's like a student newsletter that I published to. It had an interesting title, but I didn't put that much effort into it. I did a little research. I outworked everybody on my anesthesia rotation. I made flashcards of all the resident names so that they knew who I was, and so I could call them by name all the time. I just basically went overboard and did everything I could in order to match anesthesia. Finally, this is me. This is the first night of intern year. I took a picture of myself. I started off on night shift by myself. They gave me a pager and I had my cell phone, and basically there was nobody there with me. They said, if you really need help, then call the ER and they'll come help you. So my pager goes off about 2 hours later into my shift. It's about 9 p.m. And it went off. It said, I called the number and they said, well, 501 bed 3 needs an arterial line put in. And I said, okay, I'll be right up. So the first thing I did was I went on YouTube and I searched for how to put in an arterial line. I had never done one before. So I watched the video. I went up there and I asked the charge nurse, I was like, so where do they usually get the supplies for this sort of thing? And she gave me a funny look and she didn't quite understand. And then she realized that it was July 1st and she says, oh, you really don't know anything. And like, that's right. So she went and got me the supplies and I saw the patient. Fortunately for myself and for the patient, they were already intubated and sedated. And 2 hours later, I got that guy an arterial line. Nowadays, it takes me about 20 seconds to put an arterial line, but my very first one, less than ideal. So here are some of the things that nobody ever told me about residency once you get in. Residency is all about failure. You need to fail over and over and over again so that you learn. The only reason why I would wager I'm better than all of you at intubations is because I've failed at it way more times than you have. Another thing about getting into residency that's important, they really just want 3 things from you. Residency wants you to pass your boards. They want you to work hard, and they want you to not cause any trouble. If you can do those things, then you will succeed. Everything else is just bonus, you know? And lastly, try to keep your head up. Residency is largely better than medical school because you feel like what you're doing matters more. It's hard in a different way than medical school can be because you actually have real responsibility, but that real responsibility gives a little bit more meaning to your life than being on some rotation that you really don't care about. Uh, a couple other things, just really briefly on residency. Try to make friends with people in other specialties. It's something that really matters and it makes your life a lot easier. I remember during my intern year, I got called to do a difficult Foley placement in a patient that several very experienced nurses had failed to get it in. And the problem is that urology wasn't on call, and I was sort of the last line of defense to put a Foley in this patient that these nurses who had 10 years of experience weren't able to do. When I got called, I had done a total of 0 Foleys ever in my whole life, and I had no idea what I was doing. But I also had a buddy who was in a urology resident who I called. I'd met him on trauma ICU. We were friends. And I said, hey man, they have this difficult Foley. I don't know what I'm doing. Can you help me? And it's like, oh yeah, here's the secret. You have to use one. They always try to put in a smaller Foley if they fail, but you don't want to go smaller. You want to go bigger because then it won't go in a false passage. And you want a red rubber tipped Q-day catheter. And this is all the things that you do. And that was great. It turned out that I was able to get the Foley in, even though the nurses that had been nurses for 10 years had failed, because I consulted my friend. Making friends matters, and that's what'll make your life so much easier. And then also during residency, there's going to be times where your attending is wrong, or they aren't up to date, or they don't know what they're doing. And it's very frustrating for you as a resident because you're spending all of your time studying the latest stuff, learning from the best, but it's not always the best. But you still have to do what your attending tells you. The thing is, they may know something that you don't, or they may have some practical experience that disagrees with exactly what the book says, or they're doing it that way for some other reason that you're not privy to. You can voice objections in the right context, but in the end, you have to be prepared to do whatever your attending tells you to do. They have more experience than you. You're practicing under their license. And the most important thing is, imagine what happens if you do the thing that you want to do and it fails. Then it's all on you. You got to do the thing that your attending tells you to do, even if that might be a little bit wrong, so that you're protecting yourself. And in the end, the structure protects the patients as well. Next, we move to 2017. This is my chief year of residency. Here's some of the things that nobody ever told me about chief year. Some of the attendings that you work with are genuinely bad at their job. Other attendings know this, but they never really say it or talk about it out loud. There's this unspoken kind of code in medicine that attendings don't really criticize other attendings, at least not to residents or to medical students. They do once you become an attending, they talk about each other behind each other's backs, but not to medical students or residents. But yes, some of them are bad. And then in terms of chief here, one of the things I learned about in leadership is about 10 or 15% of people are going to whine about no matter what you do. So if you decide that you want to be a leader, if you decide you want to help out with a schedule or whatever it is, no matter how fair you make it, no matter how perfect you make things, a bunch of people are going to whine and you're going to feel like you suck at your job. It turns out you don't. Most people appreciate it and they just never say anything. Another sort of pro tip is when you're around leaders, try to realize this and tell people thanks. Send them a text when the email comes out if they've put something together and you can tell they worked hard on it. Really easy thing to do. Just say thank you to the people who are in leadership positions. It goes a long way to help reassure them that they're doing a good job, especially if they're doing something that might be seen as mildly controversial. Other things, if you decide to pursue leadership, the thing is, people aren't going to appreciate you out loud. It's only really worth doing, like becoming chief, for example, if you enjoy the work. If you enjoy being chief because you want people to call you the chief resident, it's not going to be worth it because it's a whole lot of work and a whole lot of heartache for something that in the end, it's not worth it for the title. But if you enjoy doing the work and making things better for everybody and going behind the scenes and being underappreciated, then it may be worth it. It's not really about winning a popularity contest, although there's part of it there too, but you have to define the capacity in which you desire to serve. This is me in 2018 as a new attending with my 6-month-old son. Here's some of the things that people didn't tell me about being an attending, which is, number one, it's pretty great. Unlike applying for residency spots, it's much easier to find a job. You'll actually get recruited from places and people want you to be there. Wherever you are, you're automatically going to get a lot more respect, which you don't even realize until you get there. I did well at my home program. I was a good chief resident, but nothing compared to the amount of respect I got as just a first-year faculty that nobody knew. People just take your opinion way more seriously than they did a month ago when you were a resident. Whatever you say goes, which can be good or bad. You can still ask for help from other attendings, which is crucial to know. You don't have to know everything starting out. Still talk to your colleagues about what you might think is right. And then surprisingly, you'll have older faculty that'll come to you and ask for advice too. When I went to find my job, it was really easy. I just sent off a cold email to UC Anesthesia. I actually sent it to the person whose office I'm in right now. 20 minutes after I sent the email, they sent me an invitation to interview. They paid for my flight, paid for my hotel, took me and 10 faculty members out for a nice dinner back when people still went to dinner before COVID. There was no formal interview. They just kind of showed me around and it was great. And I loved it and I'm still here. So I'm here to tell you that there's a light at the end of the tunnel. There's different parts of being attending that can be tough, but genuinely it's better than everything that comes before it. And also once the checks start coming in, it feels pretty good too. So 2021, which is when I made this lecture, this is me now with my family. I've been attending for a few years. I can definitely say I have zero regrets about a career choice in anesthesia. It's an easier lifestyle than being a medical student or resident, despite having more responsibility. I enjoy going to work. I'm looking forward to a long career. I'm not trying to retire early because I genuinely enjoy what I do. I think it's really worth it. So lastly, here's what nobody ever told me about the future of anesthesia. Again, this is me trying to predict the future, but are CRNAs scary? I don't think so. CRNAs, or certified registered nurse anesthetists, is something that people talk about when they talk about mid-level creep, when they talk about, oh, in a few years there won't be anesthesiologists and CRNAs will be doing everything. I'm here to tell you that's not the case. I'm not worried about it. I enjoy working with the CRNAs that I work with, but guaranteed none of them are able to do the job that I'm able to do. Do some of them want to practice independently? Yeah, sure. And maybe they'd be able to at some outpatient surgery center appropriately or something, but the amount of medical knowledge that I have as a physician just dwarfs even their practical experience, even for CRNAs that have been doing it for 20 years. One thing I thought was interesting about anesthesia, I used to think that I wanted to do all of my own cases and be in kind of a private practice model, but not so much anymore. Turns out that after I got good at sitting in the room and doing all my own cases, I didn't get much out of it anymore because once I know what I'm doing, it's just not very hard. But what is hard is teaching people and getting people to do what you want them to do and teach them at the same time. And so that's what's interesting to me. Another thing, you'll still make mistakes as an attending. I've personally never made any mistakes, but I know a lot of attendings that have, and that there are other people that do. But for me, I think I'm all set. Other things, do you need to do a fellowship? No, you don't need to do a fellowship if you don't want to. You can if there's something that you're particularly interested in within anesthesia and you want to do it every day for the rest of your life. For example, if you're really interested in cardiac anesthesia, by all means do the cardiac fellowship, or regional anesthesia, by all means do the fellowship. but it'll cut you off from some of the things that the generalists do. And I just prefer doing a really wide variety of things. I do OB anesthesia. I work consults. I do a lot of point of care ultrasound training now, which is one of the next frontiers of anesthesia. So if you really like it, do the fellowship, but it's okay to be a generalist too. And then the feeling of imposter syndrome, does it ever go away? The answer is no. You just have to keep faking confidence, fake it till you make it. I feel like I've made it. I still have imposter syndrome, but here I am giving a lecture to you guys. And then lastly, what happens when you do make a mistake? It turns out that it's okay. You're going to make a mistake. You're going to hurt somebody. That's the price of going to medical school, and you're going to feel bad about it. You might even make a life-threatening or life-altering mistake that hurts somebody. The thing that you have to do is realize that this is something that happens to everybody, and that you'll get through it. And you just have to dedicate yourself to doing better, to making sure that that sort of thing doesn't happen again. You're just doing your best. You're not perfect, but you can be a good physician despite making mistakes. Lastly, feel free to ask me anything about my presentation or anything I talked about. I've included my email address on here if anybody wants to email me later. Even if you're watching the presentation later, that's fine. Whatever you've got for me, feel free to ask me questions. Hopefully that was useful.
Wonderful. Thank you so much, Dr. Crowe. At this time, I would like to invite students that are joining us today. If you have any questions, feel free to put them in the chat. If you would like to use the raise hand function that's under the reactions button in Zoom, you are also welcome to ask your questions directly to our guest professional today.
Did I have a favorite part in medical school? Definitely the clinical years, M3, M4 year was the best. I think my very favorite part was after I had already matched and I basically had very little stress in my life. That period that after you match, which is sometime around March, to when you actually have to be a doctor in July, is pretty fantastic. I would say that that's my favorite because it's the least amount of stress, and you don't have something around the corner that's about to bite you in the butt. What classes did I take to find that I found most beneficial for the MCAT? Organic chemistry, I guess. The MCAT's different than when I took it. So I'm not going to, I want you to take my reply with a grain of salt here. The real way to get a good score in the MCAT is not through taking any particular classes. It's through studying for the MCAT specifically. So that's my strong recommendation. An easy one, what's one of my favorite books that I recommend? It's called An Astronaut's Guide to Life on Earth by astronaut Chris Hadfield. Strongly recommend. That's a really good book in terms of mindset for how to accomplish your goals. Did I love any other specialties besides anesthesia? Yeah, I thought about a few different ones. When I went to my first surgery interest group meeting, just to see what they were about, I thought I might want to do surgery, but then they said, this is a lifestyle and you're going to be working your whole life and that sucks and you better be ready to work 100-hour weeks forever. I'm like, well, no, it's not for me. So yeah, that sort of answers the specialty that's not 100% for me. But in general, I thought about emergency medicine, but in the end, they do a little bit too much primary care. And I liked being able to take care of a subset of patients for the day and then go home and then I'm done. Let's see, what do I think about Caribbean med schools? I strongly recommend against it. I think that it's, the word scam comes to mind. They take a whole bunch of money from you. it's wildly expensive, and then your odds of actually matching are very, very low. If I had the choice between doing something other than medicine or going to a Caribbean med school, I would do something else other than medicine. They are looked down upon, and there are very few legitimate success stories from Caribbean medical schools. So I know they have a lower bar of entry, and it's really appealing to some people, but the problem is that you can go to a Caribbean med school, do all 4 years, spend $250,000, and then not match. And then what do? You don't know. I don't think the same thing about foreign schools in general, although the quality can really vary. Hard to really say. Hobbies that I maintain outside of medicine, I've gotten really into smoking meat over the last year. I think that that's really fun. I like smoking brisket and ribs and that sort of thing. I have a big green egg that I got with my attending salary. I bought a drone that I like to fly around. It's kind of fun. And then I spend a lot of time with my 1-year-old and my 4-year-old. A lot of good questions.
Awesome. I have a question for you, Dr. Crowe. What would you say
Sure.
has been your most interesting case? And can you walk us through it?
I have a lot of really interesting cases that happen all the time. Let me see if I can come up with something recent. One of my most interesting cases recently was a gentleman that was seen for us in the preoperative clinic. And the preoperative clinic, based on this gentleman's medical history with pulmonary hypertension, advanced cancer, age, and multiple medical comorbidities, his heart was in really bad shape. Our preoperative clinic almost never does this, but they recommended palliative care for this gentleman instead of getting a surgery. But this gentleman was persistent. He said, "This is what I really want. I really want to get this surgery because it's the only way that I can get this lung biopsy so that they can tell if I have a type of cancer that's treatable." And the hematologist oncologist weighed in and said, "Well, if it was this thing, then maybe we could treat it." And so despite the extremely high risk involved, we organized a lot of things to try to optimize this gentleman for his surgery, for his procedure, where they were basically going in and doing lung biopsy. I worked really closely with a rock star resident of mine and with the pulmonary interventionalist, and we gave this guy a pre-op PICC line, among other things, so that we could deliver drugs directly to the heart. We started this guy on 3 pressors immediately after an extremely light induction and maintained him paralyzed on the lowest dose of anesthesia. You know, the amount of anesthesia we were giving this gentleman, I could still give this whole lecture and you wouldn't be able to tell the difference if I was on it right now. But for this guy, it was enough to keep him totally unconscious. He didn't remember anything. Pretty intense. Do I still get nervous when walking into the OR for these high-risk cases? Yes, absolutely. But you just learn how to deal with that nervousness over time. But it's still anxiety provoking. That case in particular, I looked at my Apple Watch afterwards and my heart rate was above 100 for the entire case because we were just walking on a knife's edge for his physiology. But we made it through. We got on the biopsy, and I got him to his next steps. We even were able to get the breathing tube out at the end, which was great. Somebody asked, how have I been able to balance the demands of my profession with my personal life? You just have to take time for yourself and make the sacrifices that you're willing to make. I think one of the toughest decisions that I made was marrying another medical student, or I guess resident at the time. When you have 2 doctors in the family, it can be really hard to balance your schedules, and it's very stressful, but you can do it. It's difficult. If you decide to go to medical school, it's going to suck up your entire 20s, but is it worth it for me now? Yes, it is. I'm able to provide for my family, probably for generations to come. I really enjoy my job. I get a lot out of teaching and mentorship. It's a dream come true. I feel like I've made it. Was that cancer treatable? I looked at this gentleman's records and it turned out that it was not, but that was probably the likely outcome anyway. But the important thing was that we gave him a chance to do everything we could for this gentleman. But we had to spend a long time beforehand counseling him. You know, hey, what are we going to do if your heart stops during the procedure? Do you want chest compressions? Do you want medicines to be given? Do you want us to leave you intubated? Do we need to go to ICU? We need to talk about all these things because your risk of death from this procedure, its high is 25%. It's definitely one of the sicker patients that I've ever taken care of. I also have to compliment the proceduralist who did the bronchoscopy faster than I have ever seen before. We got through the whole case in about 25 minutes, which normally these cases take a couple of hours. What advice do I have for older students? What I'll ask is, what do you mean by older and what do you mean by students? Students at what level and what age group are we talking about? So for people from ages 30 to 40 who are in undergrad or who are in medical school, starting med school, late 20s, early 30s, lots of people do it. I think that there's diminishing returns after you get to be about 40. Like you really, really, really have to want to do it. The problem is that you're at a different stage of life than almost everybody. It's going to be more difficult for you to make friends and connections. And then people expect more out of you, but a lot of people who are a little bit older also have kids and other responsibilities that take away from really focusing hardcore on medical school. They have their priorities, they have other priorities basically. So it's not impossible, but it is hard. One of the people that was in my graduating anesthesia class was a little bit older and he did fine, but he was never what you might consider a rock star. He wasn't somebody who was I don't know. He had different goals in mind than I did. I really wanted to do the best that I could and be competitive for jobs at the end and increase my level of knowledge so I could take care of as many patients as possible. And I had goals beyond just finishing residency. And I think that for the person I worked with, his goal was more akin to, I just want to finish residency and get a job somewhere. So it's not impossible, but it is hard. Any other questions for me?
Yeah, so I have a question for you.
Sure.
You talked about a little bit about the application process and, you know, kind of admissions and kind of getting your foot in the door. What advice would you have for students who are trying to pursue the field of medicine during the ongoing global pandemic?
I'm not gonna lie, it sucks. It really sucks for you guys. There's a lot less opportunities available and there's all these restrictions in place. I can't imagine being in your shoes. The thing is that nobody really knows what to do and what's allowed. I would say there's nothing wrong with sending off cold emails to somebody to ask about opportunities if they're available. You know, the worst you can hear is no. But a lot of people, if you just cold email them and ask them for help, are willing to help you. Kind of like how I got a cold email from you guys and I was willing to help. A lot of people will try to help you out within reason if you are polite and, you're professional and all that sort of things. I don't think there's any magic bullets. Just do as much as you can. Like I said, make a checklist of all the things you can think of doing. Do a lot of research online. Try to stay away from SDN. It's kind of toxic for pre-med students especially. How many hours a week do I work on average? Probably 50, I would say. I think that's about where I want to. I could work more if I wanted to. I could take more call and make more money. I could just send an email, or I could take no call and work less, but I work as much as I want. That's one of the benefits of working in academics as opposed to private practice, is I get to pick my own schedule a little bit more. I take call probably 2 to 3 times a month. Sometimes it's just during a weekend day. Sometimes it's overnight. That's pretty normal. Any medical related extracurricular activities that you recommend? There's some pretty cool medical podcasts. Find something that you're interested in and it helps you sort of learn the language of medicine. I'm not going to recommend anything in particular because the stuff that I listen to for anesthesia is pretty niche, but there's a lot out there. See what strikes your fancy.
Awesome.
On medical,
Sorry.
just one last question I see on here. What's the most unique thing that an applicant indicated on their app? Hard to even say. There are a wild amount of different life experiences that people bring into medicine. The last time I looked at med school applications was a long time ago, admittedly. Most of what I look at these days is residency applications, but I've seen, I saw something that somebody was like, oh, I do art on the weekends or something. And they had a link to their website and there were a full-blown legitimate serious artist. I was browsing through their webpage and I thought, wow, this person could just do this for a living super easily. A lot of people who get into medicine are really intense people in general, and that intensity gets applied to anything from like mountain climbing to playing instruments to whatever it is. So you get to see a lot of really interesting, diverse people with diverse skill sets in medicine.
Wow, that's really interesting. I have a question regarding your specialty, and how common is it for someone in your specialty to deal with malpractice?
The good news that I can share is that malpractice premiums for anesthesia have gone down really significantly over the past 20 years or so. And the reason why is because anesthesia has a very strong focus on patient safety. And it used to be that you'd hear about people talking about, oh, anesthesia, your malpractice must be high, but secret, it's really not anymore. It's nothing too crazy. And for me, working in an academic institution, I'm protected under like a blanket policy or whatever. I don't even think about it.
Definitely. Thank you. What would be some ways to avoid burnout as a physician?
There are books written about this sort of thing, but the things that have worked for me are making sure to take time for myself. I tend to be somebody who's hyper-focused on doing things as efficiently as possible, but I've had to tone that down a little bit. Like, for example, I've just gotten home from work and I have a nanny that's watching my kids and I pay her by the hour. The thing that I could do is just send her home as soon as I get home and take over watching both my kids. But sometimes what I do is I tell my nanny, do you mind staying an extra hour and a half? So I can just take some time to myself, go lay down, chill out, browse Reddit, whatever it is, so I can decompress a little bit, especially if I've had a tough day. And that extra 25 bucks an hour that I pay my nanny is worth it for my own sanity. So find little ways, even if they're not the most efficient thing in the world to do, to treat yourself right, make yourself a nice wine and cheese plate, whatever it is that you like. Try to do that, make time for yourself. Are there opportunities to pursue research as an anesthesiologist in an academic center? The answer is yes, but in general, I would say that anesthesiologists aren't as focused on research as some other careers are. I would say that there is research, but there aren't as many anesthesiologists who do it. I think the reason why is because anesthesiology is really big on doing things and making things happen quickly and not spending all of our time doing documentation. And that's sort of the opposite of research. There are some people who do it, and there's lots of opportunities that aren't necessarily pure bench research driven. You can do with QI projects and everything else. I find that sort of stuff a lot more interesting. I'm a part of some of that kind of stuff, but in terms of pure research, you can, but that's a pretty particular track. Yeah, QI, quality improvement, right.
Definitely. Thank you. How much of your time is spent with patients versus doing administrative work?
I have a very different answer for this than most anesthesiologists that I work with. And I'll give you a range. I started work here with a now friend of mine, and we graduated the same year, and we both started working at the same time. And he went the track of just being in the OR all the time and taking call a lot. And to my knowledge, I don't think he's ever been to a meeting for any sort of committee or anything like that. And so he basically has 100% time with the patients. And when he's done with work, he's done. For me, I have a very different perspective on things. I basically joined as many committees as I could. I'm the physician chair of the sedation committee across a couple of hospitals. And so we had our meeting this morning. I have an assessment committee meeting later where we go over graduate medical education assessment and try to work on improvement for that. I'm the chair of the clinical competency committee. And so I spend a whole lot of time trying to improve things. And so the amount of time that's non-clinical for me, I get sometimes 3 or 4 days a month, which is like 1 day a week, but it's purely doing things that are not strictly patient care. So I'm probably on the other end of the spectrum than my other friend who makes the same amount of money that I do and does all the same things, but you know, he's a great anesthesiologist and he mainly works with patients, and I just do a bunch more admin stuff. I would much rather have my job and he'd rather have his job, and that's fine.
Wow,
There's
thank
room
you
for
so much.
whatever you like doing.
Definitely. I think it's really insightful to see just the variations, as you mentioned, kind of on a spectrum, that, you know, even going into anesthesiology, there's so much variation within the job that you can really do. And I think that's really interesting for myself and other students joining us today. My next question is kind of in regards to your overall journey. How do you feel like medicine has influenced you, for example, how you view life and death, or even your personality?
That's a really good question. Medical school, I tell people this all the time, medical school will change who you are as a person. You will be a different person at the end of it. And you'll look back at who you used to be and it will just be different. It's not bad or good. It's just different. The things that you see, the people that you talk to, the people that you're around, it's all going to shape you into a different person. And the reason why is because you're in such a high pressure situation, you're being pushed to succeed. That pressure really will bring out who you are. Like what kind of person are you? Are you the kind of person who's going to succeed? Are you the person who's going to push through, or are you the person who can take it? You know, you really find within yourself who you are during some of these most stressful times.
Wow, that's beautiful. Thank you so much for sharing that with us.
Sure.
Regarding the patient-doctor relationship, do you feel like your patients feel like they can trust you? And is there a particular stigma preventing certain patients from relying on you as a provider?
One of the most important things I do in anesthesia is I have the opportunity to meet people what's potentially one of the most stressful days of their whole life, whether it's OB anesthesia and there's a mom that's afraid that she's going to die or be paralyzed from an epidural, or if I'm meeting somebody who's having a panic attack because they have a phobia of needles. I see these situations every day, and I have to very quickly make people trust me. So anesthesia is definitely a job for people who are good at forming really rapid connections with people as best you can. It doesn't always work, but what I recommend against doing, some doctors I've heard say, which I think is wrong, is I treat every patient the same. If you're treating every patient the same, then you're missing the point. You know, patients don't respond to that. I treat every patient like it's improv class. Some patients really want to see that you're the confidence person. Like they're really anxious and they really just want somebody to be like, I'm really damn good at this and I'm going to take care of you and everything's going to be okay. And some patients need you to hold their hand. And some patients want you to joke around with them. They kind of tell a little joke as part of what they're doing. And if you tell them jokes back or goof around with them, then that makes them feel at ease. So I would say treat patients differently, do whatever you can to get rapport with that patient. Even as much as, you know, doing some linguistic switching with the types of words that you use for different patients. You know, I grew up in Southwest Missouri, and I know people who are pretty rural, and I can switch my voice around to make it more comfortable with them. You know, like, yeah, I think you're going to be just fine today. You know, that'd be an example of how I could switch my voice around a little bit to make them feel more comfortable. Every patient's different. What do I think about PA school? Is it as equally as rigorous as med school? It is not. I'm not saying PAs are bad. I think they're great, but you know, it's an easier track to do, an easier job that gets you a lot of the benefits of being a physician. Personally, I wouldn't want to be always having to check my work by somebody. I want to be the last line of defense. I want to be the expert in the room, and that's why I wanted to go to medical school. But a lot of people don't feel that way, and they say, well, why can't I just go to school for a little bit less time, do a lot of the same things, and still get a good paycheck? If you're the person that's okay with that, I absolutely recommend PA school. In fact, I would say I recommend, if you can think of something else that you'd rather that you can do other than medicine that would make you happy, then do that. For me, there wasn't really anything else that I wanted to be than being a physician. And that's what got me through. Is if there was something else that was easier, if I liked finance or if I liked computer programming or something like that, then the money doesn't super matter. And even if I was making more money in business or something else, you know, if you worked this hard that I've worked to get to where I am in business, I'd probably make more money than I make now. But not super fulfilling. I get a lot of fulfillment out of my interactions with my patients and out of teaching and mentorship, and that's makes a great life for me.
Wonderful. Thank you so much, Dr. Crowe. Our final question for you is, do you have any last advice for the students joining us today, either live or asynchronously?
Whatever you want to do in your life that you really want to accomplish, write yourself a list of goals and then just start checking them off. It works. And then if you decide you want to go the career path of being a physician or whatever it is you want to do, throw your whole heart into it. Don't hold anything back. You only get one shot at life. Give it your best shot.
Wow. Thank you so much, Dr. Crowe, for joining us today. It was an absolute pleasure and honor to hear your story and your perspective on the field, as well as the advice that you've been able to provide to us today.
Sure. Thank you, everybody, for joining.
For all of the students joining us today, please stick around if you're interested in getting a certificate that verifies your virtual shadowing hours with pre-health shadowing and Dr. Crowe today. But before we begin, I'd like to take a moment to invite everybody for a quick reflection. And we encourage individuals who participate in pre-health shadowing sessions to reflect on these sessions, because this is going to be really important when the time comes for you to apply to your various programs, whether it be medical school, PA school, nursing school, etc. So take a moment, check out these questions, feel free to write them down. And I encourage you, if you'd like to submit them on the pre-health shadowing website to get recognition, you can submit them through prehealthshadowing.com/blog submissions. We take articles, reflections, reviews, and success stories. Again, if you're interested in being a part of our student-led nonprofit organization, you are able to register online, either for a student volunteer position, as well as apply to join our leadership team. This can all be found on the pre-health shadowing website. Again, we do humbly ask you, if you can, please donate. Our program is 100% student-led and is completely run off of the time and donations of our volunteers in our community. If you are financially unable to donate at this time, I encourage you to send this link to someone who supports your education and the mission of creating pre-health shadowing opportunities for students all over the world. Now, the moment we've all been waiting for. If you're interested in earning a digital certificate for attending a pre-health shadowing session, what you're going to do is go to the pre-health shadowing website and find Dr. Crowe's session. It'll be on the home page. You will have 10 multiple choice questions based on today's presentation. You will have 2 chances to pass with a 70% or higher to verify your virtual shadowing hours with us today. Again, if you missed any part of the session, this will be posted on our YouTube channel and on our pre-health shadowing website for review at a later time. Be sure to catch our sessions. You can make sure to keep up on the pre-health shadowing website, as well as follow us on Instagram or TikTok and Facebook. Thank you again, everyone, for joining. This marks the end of our virtual shadowing session today. If you have any questions for our student team, feel free to stick around. If not, I hope you have a lovely rest of your week. And thank you again, Dr. Crowe, for joining us.
Absolutely.
Bye.